For another global issue that is of concern to many today, let's talk about health. Dr. Cruz, health epidemics and the health and well-being of humans around the world is often on the front pages in the sense that diseases travel. There was a SARS outbreak many years ago, the swine flu, the bird flu, these diseases that travel because people travel. They get in cars and on trains and on boats and on airplanes, and they move around and they expose others to their illnesses. Mosquitoes travel, and so you'll find, West Nile virus and various forms of malaria traveling, from one place to another because mosquitoes also travel. I mean, disease is not a subject that respects national boundaries, and therefore, like other global issues, is one that is a common problem and something that should be addressed collectively. Perhaps one of the most challenging things here, though, is that a lot of this stuff is preventable, and yet we haven't found a way to fully prevent diseases that are killing far too many people when they could be prevented with vaccinations, for example. So, Dr. Cruz, what do you think about this issue?
I think this is one of those issues that when we're talking about healthcare, there's a couple of things that come to mind. First is that it's really difficult to separate the environment from health. A bad environment leads to bad health. So if you have dirty drinking water, you're going to have disease. This is also one of those issues where the global south seems to be affected more because they are less developed. And so we have a number of people dying in the global south from things like diarrhea. Sounds pretty silly that people can actually die from this, but it's happening in the millions, particularly amongst children. This is something that is preventable. So we're talking about some politics here, the politics of getting the drugs and the medicine to people that need it, and a politics of economy, the haves and the have-nots. Even if we think about this country, those that have the best health care, those that have the money. So some serious issues there. Another one I would point out is obviously HIV/AIDS, something we have become very familiar with in the last couple of decades. And the challenge that we're fighting in this country is that many people now can survive with HIV/AIDS, so we're not paying as much attention to it. If we look at the developing world, we look at the global south and Africa in particular, there are some countries where over 40% of the population is affected by HIV/AIDS, and yet the beliefs in how this is spread, they're not educated on how HIV/AIDS are spread, and we hear from politicians who have claimed that you do not get HIV/AIDS from sexual transmission, so it's very difficult to fight that battle there.
So clearly the consequences of health and disease are significant, and we can see the evidence of that. But the solutions still remain elusive. I mean, we've made much progress, through organizations like the World Health Organization, the United Nations, and other activities that, send doctors out to provide vaccinations, provide funding for vaccinations. Doctors Without Borders, there are a lot of non-governmental organizations and relief organizations that are traveling the world to address some of these very preventable problems, as you've been mentioning, but also helping countries to establish good sanitation practices, hygiene, education about things like HIV and AIDS and how that disease spreads. So we've made some progress, but this is still a very challenging issue because it's really hard for people in, let's say, average citizen in a particular country that doesn't face these problems to really understand why it is that children dying in a remote African village from preventable diseases really matters. But I think one of the things that we can say about what research shows is that addressing these issues and enhancing the health and well-being of impoverished communities contributes to their development, their long-term well-being, their ability to then go to school, provide an education, get an education, and ultimately bring themselves out of poverty. So clearly there's a very strong relationship, as you mentioned, between health and environment, but certainly just health, environment, prosperity, and development.
And I would just add that in those situations where people are going in and helping, where organizations are helping, it's very important that they look at the local context. A solution that's going to be successful in this country or in the United States is not necessarily going to be successful in a remote African village where you're dealing with their own culture and their belief system. So you have to think about the local context and think about solutions that will work there.
Definitely, like many others, a very challenging global issue. So students, think about these global health problems and let us know what you think about how best to solve them.